live stream on my main YouTube channel is disabled due to a copyright strike. It should be available again on November 3rd, 2020. To view my live streams, see the description box for details on how to get to my other channels. My backup YouTube channel, DLive, and Twitch will still show my live streams. There is no weapon more deadly than the will. Bruce Lee. Good afternoon. Okay, looks like my mic is working. We're set. I have to go and pick up my daughter in about 45 minutes, so this shouldn't take very long. So let's get right to it. Now, one of the things that I saw that I was doing was just kind of looking into just keeping up with how the COVID-19 is doing. I looked at this article, which was I just wanted to compare COVID-19 to other viruses and find out, hey, let's look at the most deadly viruses and what constitutes that term, and what is it about this virus supposedly that's different than theirs. And of course, this pandemic, I call it a plandemic, and maybe you'll see why just looking at the data. And for those that don't know, my vocation before I stopped working was as a quality assurance engineer, so testing a lot of data-driven products in the software side and working with a lot of hardware. Notable places like AIG was my previous one. Before that, notable is Raytheon BBN Technologies, and a notable company was Microsoft before that. So a couple of different places that a lot of people will recognize. So a lot of that work is data driven, and so right now this analysis is going to just be a data statistics driven analysis. And one thing to keep in mind is when I'm going through the actual statistics and the data is by what measure do we measure viruses as deadly? So basically, you can read this article. You can tell it's life science just by looking up the title. What I did was I compiled a list of that the article went through, and I know it's a little bit hard to see, so you're gonna have to bear with me. That should be a little better. All right, so there's 12 mentioned. There's a couple more. What I did was I have a couple different types of diseases, deadliest diseases, not just viruses. There's bacterial viruses. Let's zoom in a little bit more. I think that's good. Like the Black Death, bubonic plague, and tuberculosis, which is current. So this is all due to bacteria, and of course the numbers are much more staggering than viruses, as you'll see. And then there's parasites. There's malaria, which is worldwide. Some of the data is not current. The latest I can find is something like from 2016, so it'll mention the year. And this is taken from CDC link. And total number of cases is 216 million. Total number of deaths is 445,000. Percent mortality is 0.206%. Time until death is 1 day. And you're going to see a lot of that I label up there. And this is just in a year. So when I'm going through viruses, you're going to see the outbreak location, year, strain, the disease name, total number of reported cases, total number of deaths, mortality percentage, time until death. So by what measure do we measure a virus as deadly? Is it the number of people that have it, or the number of people who die from it, the mortality rate for basically whoever gets it, how many of those that get it end up dying from it, and or maybe the time until death? Maybe you get this disease and you die within a day, or you get this disease, you die within, does if you see if you talk to a virologist, if ever ask them the question, what makes a virus deadly in terms of especially a pandemic? Now, the time until death, that can be a factor because and something like what you might call an incubation period. Basically, you have the virus, you don't show any symptoms, and you can still pass it along to other people unknowingly. Now, when you become asymptomatic and you have symptoms, from then, how long do you have until you die? If you die, all the mortality percentage is different. So there can be a lot of factors. And what we're going to be also doing is comparing the deadly viruses, how many people that die. And a lot of these are just totals, total ever, as compared to some that might say by year. And basically this is just something here, which is the total number of deaths in a year in 2016, the top 10 leading causes of death around the world, if you're a globe, around a flat Earth, too, whatever you want to call it. So you've got the ischemic heart disease and stroke, which is from the WHO, the top 10 causes of death article, May 21st, 2018. It's 15.2 million deaths in a year, which is incredible big amount. The world isn't being shut down by this. And second is 3 million deaths a year from chronic obstructive pulmonary diseases, lower respiratory infections, basically communicable diseases like colds and flu. It's 3 million a year. We're not even close to that with COVID-19. We're not. Basically, the common flu is more deadly than COVID-19 at this rate. Now, so let's go ahead and look at and where am I getting this data? This is, that's just dementia. Again, this is all from the WHO top 10 causes of death, and we can go ahead and see that here. And it's taking it straight from, oops, not that one, 3, okay, straight from the horse's mouth. So you have all the data here that you can see. So this is the World Health Organization. That's as I'm gonna always repeat, I'm always gonna get the data from sources that most people consider legitimate, government sites and organizations that these government sites always seem to refer to, educational sites from universities, etc. I'll even use mainstream media sometimes. So it won't be from publications that are obscure and just from someone's spoofed website or something like that. Okay, so let's get back to the viruses. Again, this talks about Marburg, and when I'm looking through, I want to collect more data because sometimes the data is not there. It's just an article with their opinion on what the deadliest viruses on Earth is. So I go to the World Health Organization, February 15, 2018, talks about how the Marburg virus disease mortality rate is 50%. overall, and you have about 8 to 9 days until you have it and you die, or you show symptoms and you die. The total number of cases since 1967, where it was found, only 466 people had reported confirmed cases of Marburg virus disease, and out of those, 373 people died. Mortality rate is 80% from the CDC, as opposed to the WHO, which specified 50%. So this is considered one of the top 12 deadliest viruses on Earth, and it only killed 373 people. So if you're measuring what constitutes a deadly virus, in this case, the Marburg virus disease wouldn't be deadly as in the amount of people it killed. 373 people out of billions is almost laughable. But I guess what is deadly as a consideration of how to measure it is mortality percentage, where, hey, if you do get it, you have an 80% chance of dying in about 8 to 9 days. So yeah, that can be a consideration. Next is Ebola, which a lot of people have heard about. I think it first appeared back in 1976. There's a couple of different strains: the Sudan strain, the Bundibugyo strain. I'm not sure if I'm saying that right. The article states 71% dying from the Republic of Sudan, and the Democratic Republic of Congo, 50% as the mortality percentage. And hold on, I'm going to go ahead and freeze the panes. Let's see. All right. Now I'd have to go to World Health Organization, where they'll specify, yeah, it was about 50% mortality rate, and once you have symptoms, you usually die from 2 to 21 days. Now, mapping the outbreak, this is from BBC.com news, total number of reported cases, and this is in January 14, 2016. Total number of cases, 28,637. Total number of deaths is 11,315. Mortality rate overall was 39.5%. So constituting what makes it deadly, again, is not the amount of people who've died from it, maybe how many people that get infected die from it, which is 39.5% is pretty high. Then you have rabies, which is still concurrent. Now there's a once you have it, or you think you have it, and you get a vaccination, and that'll prevent you from having full onset rabies, because once you actually have rabies and are symptomatic of it, the time to death is 100%, and the time until death, I don't know, I couldn't really find it. I guess it's different. From what I remember is that if you have it, you're just constantly thirsty, but you just can't drink anything. So that's how you end up dying. So you have 59,000 people a year that die from it, or that get it, and 59,000 people a year that die from it. Now, of course, I couldn't find out any data of how many people who get it and how many people are vaccinated that end up surviving from it. So that's something you'd have to search. But basically, CDC writes that every 9 minutes, someone in the world dies of rabies. Next is HIV, and this I couldn't find a total from the onset of when HIV. And HIV is different because you don't die from HIV, you die from AIDS. But anyways, they do have data on it. Total in 2019. There's 38 million existing total reported cases, and there was 1.7 million new reported cases. And overall, out of those 38 million, 690,000 people died. So in a year, 690,000 people dying can be considered a lot more than any of the others mentioned before. in just a year, but the mortality rate is low, 1.815% in 2019. So it's very survivable once you get it. It's just a lot of people still die from it every year, so that constitutes a deadly disease. So it's like the odds of getting any of these diseases, the ones with the highest mortality rate is a lot more rare that you'll end up getting it. But if you do get it, you have a higher chance of dying from it. Now, smallpox, which many say they're eradicated, before 1980, the collected data was 33% people who get it died from it. 90% that were North American natives died from it, as compared to the general population of 30%. I had to go to a different place, ourworldindata.org. The time and total death was around 10 to 16 days. And in the 20th century, 1900s, the WHO, excuse me, total number of deaths in total was from 1900 to 2000 was 300 million. So as far as something that was a disease that was ongoing, it would be considered like the probably deadliest disease. And if this is correct, 33% chance of surviving is not a good amount of a survival rate. So basically 1 in 3 people who get it will die from it in 10 to 16 days. So smallpox could probably consider right now probably deadliest one so far we've looked at. Now there's hantavirus that was mentioned in the 12 deadliest viruses on Earth. So there's Four Corners, U.S., 1993. There's 36% that got it. The people who got it that died from it was 36%. Korea in 1950, of the people who got it, 12% died from it. At CDC, the data on it was mortality percentage was 36%. Time until death was 3 to 5 days. And then you got ncbi.nlm.nih, which total reported number of cases is around 150,000 per year. And this data was collected from 1950 to 1997, which states that it was 1,256,431 people who got reported of having it. Total number of deaths was 44,304. But the mortality percentage is only 3.53%. So there's a lot bigger difference from what's reported by the CDC, by the NCBI. Influenza. So as far as this, it doesn't seem like it's a very deadly disease, but it's listed in the top 12. Influenza, which is a strain of what you might call the flu, Spanish flu 1918 is listed, which didn't really give any numbers. Now, if you go to NCBI, different articles will give you the total number of reported cases. Now, 500 million was the total percent of cases. Total number of deaths was 50 million. So in 1 year, 50 million people died from it. And the population 1918, you might want to look that up. But anyways, of all the people who had it and the people who died from it, it was 0 to 2.5%. And then that's from the NCBI. And there's this another article where it was about 10% that was estimated, the mortality percentage. And again, another article, it's basically 11 days until you have symptoms that you'll end up dying from it. But at these numbers, pretty low. I mean, the total number of deaths is pretty high, 50 million. But I mean, say if the population was 5 billion back then, it's 10% of the population ended up having it, but of that who had it, it's a very survivable disease. And again, a lot of people will see a lot of data on that Spanish flu pandemic again. Dengue, mortality percentage is 2.5%. So basically, whoever get it, this is from Philippines and Thailand. This is in the 1950s. So of the people who had it, the percentage of people who died from it is 2.5%, which is not a lot. It mentions overall that 20% is the mortality rate. And once you go to the WHO, the mortality rate is anywhere from 1 to 20%. And the time until death is 4 to 12 days. And CDC has more data on it, but basically 400 million people a year end up getting it, but only 22,000 people per year end up dying from it. So your odds of surviving it is really great. Basically, they state that it's the mortality percentage is 0.00055%. So what constitutes deadly disease isn't the mortality percentage, but the number of people who die from it, which still isn't a lot as compared to people who end up getting it. So, like if you had to pick a virus that you end up getting, I would probably, on this list, just looking at the data, I would probably want to have dengue fever, because, well, maybe, yeah. So, because you have a chance of dying from it is 0.00055%. Now you've got rotavirus. Basically, it only really affects children under the years of 5. The article says basically the mortality percentage is 0.00033% per year that die from it, and time until death is 1 to 7 or more days. Now that's not a high mortality rate. That's probably second from the dengue, and but what constitutes is how many people get it, and the total number of deaths. So in 2000, 528,000 people died from it, children under 5 years of age, and in 2016, 215,000. Even the reported number of cases is weird, like they say in trillions. But yeah, another survivable virus, though it's claimed a lot of deaths. And so we're going to see that pattern. And again, awareness of patterns is something that you want to know. So SARS, basically in 2002, in the article, this mortality rate is 9.6%. NHS, time until death is up to 10 days. Total number of reported cases, you probably saw a lot of news regarding it. It's 8,100 total number of cases, confirmed cases, but only 774 people died from it. So all the news that you probably heard from it back then about SARS outbreak, not a lot of people died from it. But still top 10 diseases, you have less than 10% chance of dying from it once you do have it. I'm going to skip SARS, basically COVID-19 for now, just to cover MERS, and I'll go back do SARS, COVID-19 in depth. I have about 13 minutes. No, I have about 20 minutes, less than 20. Anyways, MERS, Saudi Arabia in 2012. Mentions it, and same thing with South Korea in 2015. Basically, the mortality percentage was 30 to 40%, which is on a high scale. NCBI shows data from 3 to 30 days, and the mortality percentage of people who die from it within 3 days is 13.8%, and people who have it that die within 30 days is 28.3%. The WHO shows mortality rate as 34.3%. Again, they updated in 2020 that it's 34.4%. You would think that, wow, that's another deadly virus out there. But of only 2,494 people got it and 858 people died from it. So even though the mortality percentage is high, the number of cases and deaths is very low. So again, another pattern that you see. So we're going to cover SARS, COVID-19. Mortality rate from that Ann Harding thing is 2.3%. If you go to drugs.com, it states that the time until death is about, on average, 18.5 days. So if you do get it, you'll probably die in about that span of time. Now, the WHO estimates the mortality percentage is 0.1% to 25%. You would think that they do a better job of analyzing their own data or whatever data that they've got. Total number of cases, and for some reason the commas didn't show. This is from what happened to the data that I had on it? It just disappeared. Oh, I have all these notes from it that I didn't go over. Anyways, a lot of this is just copy pasted from the articles. So let's look at the data right now. So this is from Johns Hopkins University. Currently, as of today, there's about almost 24 million people who has had reported cases of it. Of those who have it, 814,852 people died. Now, if you do the math, the percentage is 29.11%, which is very high. So when you, but you know, it ranges, depends on the country, and the data is very skewed. For example, Yemen is the only country that has anywhere near 29% of mortality percentage. And that's with 1,916 confirmed cases and 555 deaths at 29% case fatality. Italy is next highest with 260,298 confirmed cases and 35,441 deaths at 13.6% case fatality. And we can verify that by looking at the actual data itself. This is Johns Hopkins University, and we just look at case fatality percentage. Yemen, again, 29%, Italy, 13.6%, and these are top two. So it's nowhere near 29.3 cases mortality percentage. And that, where I'm getting this data, is global cases here in red, global deaths here. So this is supposedly as real time as it can get. So if you basically find a percentage of the total amount of global cases and the global amount of deaths, you're going to get 29.3%. So, but see, the data doesn't add up, because when we actually look at the tables that are mortality analysis of COVID-19, you're going to see that overall the mortality rate, case fatality is not the same. Now, what I also do is, now this is just a small set of data with the high percentage rate. And again, that pattern, right, where you see a small number of people dying that have it and dying from it, but the amount, as far as percentage, mortality percentage is going to be a lot higher, as opposed to the amounts of people that have it with a high amount of cases, high amount of deaths. The case fatality is low. So we're going to get a bigger subset of data, probably more accurate, because a lot more tests are being done, if this is in fact a real thing. Now we're going to see that the top three, with US, Brazil, India, the case fatality is 3.1, 3.2, 1.8%. So if you end up getting, now here's the thing, I do a little bit more analysis on it, is if you end up getting, all right, let's look at the current world population. You could just do a Google search, taken from 2018, is around 7.5 or 7.6 billion people, with the total world population. Now, of the 23.7 million confirmed cases, that's only 0.31% of the world's population that has COVID-19, has or had it. Yet only 0.01% of the people died from it. So mortality rate of 0.01%. That's so basically, I don't know. Let's see, 100,000, 10,000. So basically, 1 out of 100,000 people that have it will die from it. Now, the current U.S. population taken from 2019 is 328.2 million, with 5.7 million confirmed cases. That's only 1.7% of the total U.S. population that has confirmed COVID-19 cases, and 0.25% that has died from it. So at that rate, if you have it in the U.S., out of like 200 or 25,000 people, basically if 1 out of 25,000 people who get COVID-19 in the U.S. will die from it. So you have a 3% chance of dying from it. So that data is also written down here. So again, we can say that this 29.11% is very skewed. In reality, if we take the top 3 confirmed cases by country, which is going to total like over 11, maybe even 12 million people, and we get the total percentage of those top 3 countries that have it, the mortality rate is 2.7%, less than 3% chance from dying from it once you get it. So it's very low, the number of people who've died from it, and this is of course not over yet, what they can collect. But now let's compare it to just what people die from around the world. So the top 10 leading causes of death. So where does that stack in? So 814,000 people, not quite in 2020, died from COVID-19. More people died from AIDS. This is back in 2016. More people died from tuberculosis, diarrhea, road injuries, diabetes, lung cancer, dementia, the common flu, like strokes and heart disease and pulmonary diseases. So it's got a ways yet. If this is August, you've got September, October, November, December. We've got about 4 more months in 2020. So if you just do the math, you just 1/3 more of 800,000. It may top out at 1.2 million. So it still wouldn't even make the top 10 leading cause of death in 2019. Maybe it might edge out HIV/AIDS, but we'll just have to see. Anyways, that's just something that you can do yourself, and I know a lot of people probably haven't done their own research on it, so I did it for you, and you can just review all of this, and if you find anything that's a discrepancy, you probably won't. Now I'm gonna look at chat because Manatalk is here. We're on the same page. Pandemic. I shared this on my Facebook and Twitter accounts. Keep up the good work. Hey, James, how's it going? Anyways, this is just something that if someone's really, they like to segue, right? And it's like, hey, let's talk about what makes COVID-19 deadly. Is it the mortality percentage? Because the mortality percentage is 3%. Is it, when you get it, you're going to die in a couple of days? Not really. You die in almost less than 3 weeks on average. Total number of cases, You know, it's not even reached 1% of the world's total population yet. Total number of deaths, well, 814,852. You know, isn't something to laugh at. So maybe it's just, you know, people, the number of deaths, and yet it's still not up there with even the common flu, which is more than 3 times the amount of deaths. You know, yet no one is stopping, preventing you from going to work, wanting or saying you should wear a mask, or you know, a lot of people who are just going to be yelling at you or angry at you for not wearing a mask. Is you just ask them what makes COVID-19 deadly, rather than talking about whether masks are effective or not at stopping it, which, you know, if it was easily shown any research data on that, you can use that as an argument, but, you know, it's still besides the point. You know, I'm okay with getting COVID-19 because I know I have 1 in 25,000 chance of dying from it, which is very low. I'm more worried about, hey, dying, you know, in a car accident. You know, more people will die from car accidents than that. I'm more worried about dying from diarrhea than COVID-19. So, you know, just something to think about. And a lot of people just, a lot of focus, a lot of attention is on it. But once you become more aware and use the data that's provided to you by the same control systems, I guess you could say, there really isn't anything to fear from it, to be anxious about. People who get angry from it, you could just ask them, okay, well, what makes the COVID-19 deadly? And they say, well, you know, you have a 29% chance of dying from it if you get it, but we see that's not true. It's closer to 2.7% or maybe 2.8%. You know, it's barely 3%. In the US, it's about 3%. What's going to be interesting is when we see data of how many people in the US die from the common flu as compared to the COVID-19, if they can differentiate, or if they ever even do differentiate from it. That'd be good data to see. So, you know, less people died from the common flu, more people died from COVID-19. Yet, as for being death from influenza, is that going to be more than just the common influenza strain, or less than COVID-19? Yeah, and there's still a lot to be said from Mana says, we still do not have the factual COVID death numbers, as you could die of jumping off a cliff, but if you use the wrong PCR nasal swab test and they mark it as a COVID-19 death. Yep. And of course, a lot of people have mentioned that hospitals get paid more if they diagnose COVID-19 and treat COVID-19, and if someone dies from COVID-19. So there's going to be incentive to have someone stated as dying from COVID-19 because, look, doctors have a lot of bills to pay. They've got probably a lot of loans to pay off. Their hospital likes to make money. It's privatized industry. You know, they're going to be taking any incentives they can get, and who cares if they smudge a little data? You know, death is a death, right? Of course, the more concerning factor is whether, you know, they're actually causing people to die when they may not have the COVID-19, just to get the benefits of more money. That would be horrible, especially for the doctors, which are supposed to help people. At least that's what you would think. Anyways, thank you for this and sticking around. Do this yourself. It's, you know, creating a spreadsheet like this is pretty easy. You know, get data from where mainstream media tells you to get data. A lot of the data that they're using is from Johns Hopkins University. You know, the World Health Organization is and the CDC and NCBI and all those places are gonna have their own figures. They may even reference Johns Hopkins University, and then just compare it to just all the deaths that occur either in, like for the CDC, we'll have it for the US, or if you go to the World Health Organization, they'll have data for all the countries combined, or many of the countries. So there you have it. So basically, when I get into a conversation about wearing masks or not, I'm usually saying, well, I'm not worried about having COVID-19 or my kids having COVID-19 or anyone else having it. It's just a low rate of percentage of death. You have a higher chance of dying from many other factors, and whether or not wearing a mask prevents it or not, it's really negligible. It's like whether I would rather have I will pay more attention to myself driving than worrying about a mask when you're not driving. Anyways, thank you for joining me. I'm probably gonna have more material sometime this week. Who knows when I'll be able to get it out there. Anyways, thank you for joining me on this one, and I'll see you later.